Hi, this is Andrea Kane, and this is HSC 114 Medical Terminology. We are in week 4, looking at chapter 8 in the book, which correlates to unit 4 in your syllabus, which is female reproductive system. So let's get started. Sexual reproduction. What is this? It's the union of the nuclei of an ovum and a sperm cell. Those are called gametes, and each gamete contains half the number of chromosomes of a normal body cell. Those are produced in the gonads. Female gonads are the ovaries, males are the testes. An ovum leaves the ovaries, travels through the fallopian tube. If there are sperm cells present and they unite with the ovum, that's called fertilization. The fertilized egg then implants and divides to form a ball of cells called a zygote, and that continues to grow, becoming an embryo and then a fetus, which is a baby. Organs of the female reproductive system that we're going to talk about in this chapter: ovaries, fallopian tubes, uterus, cul-de-sac, vagina, Bartholin glands, clitoris, and perineum. And here is a visual so that you can see how all those fit together and where they are in the body. So this is very helpful. Okay, moving on. Fertilized egg implants, then divides to form a ball of cells called I just gave this to you earlier, so hopefully you remember. And this is another view of these organs that we're going to be looking at: ovary, utero-ovarian ligament, ovarian follicles, ovum, corpus luteum, fallopian tube, fimbriae, uterus, endometrium, myometrium, uterine serosa, cervix, and vagina. And here's a really good visual to show you from a different direction how all this works together. This is helpful because it shows you the arteries and veins, the ligaments, some more detail in the different parts, but as opposed to the visual we had a couple slides back. This really focuses on the organs that we're going to be studying. So, also included in the female reproductive system are the breasts. Those are made up of glandular tissue, fatty tissue, ducts, and sinuses. Yes, sinuses. Sinuses are one of those words that are used throughout the body in several places to talk about spaces. So here you go. This is a side view of a breast. Shows you the lymph nodes, the muscles, glandular tissue, ducts, those sinuses, the fatty tissue, and where the ribs come in. This is one of the views that are taken when you have a mammogram. Let's talk about menstruation. Days 1 through 5, the blood cells, endometrial cells, glandular secretions discharge from the body. Days 6 through 12, the estrogen repairs the endometrium and your ovum grows in the follicle. Day 13-14, egg heads out from the ovary, passes through the fallopian tube. Days 15 through 28, the corpus luteum secretes progesterone. So remember estrogen and progesterone in this process, and the uterus lining builds up, and then you start all over again with the secretions. And this is a good visual. It gives you an idea of when your estrogen is high, when your estrogen and progesterone, they work together, when they're high, when they're low, and what's happening in the ovary while this happens versus what's happening in the uterus. Pregnancy. If fertilization occurs, that means that the egg is penetrated by the sperm and fertilized. Then the egg implants in the uterine endometrium, The placenta forms and attaches to the uterine wall. Amnion holds the fetus in an amniotic cavity. Nutrients, oxygen, and waste exchanges, they exchange between the baby and the mother. And the placenta produces human chorionic gonadotrophin, HCG. And that's what a pregnancy test does. A pregnancy test measures the level of HCG in a woman's urine. And that, because the HCG level increases quickly during the first, I don't know, 8, 10, 12 weeks of a pregnancy. And so that's why pregnancy tests, that's what they're doing, is they're looking to see, is there a very low level of HCG, which means pregnancy test will be negative, or is there a high, much higher than expected level of HCG, and that's when the pregnancy test will produce a positive result. And so there's implantation into the uterus. And you hope it's not at the opening of the uterus. Have you ever heard of a condition called placenta previa? It's where there's implantation in the uterus, but it's down at the opening of the uterus, down by the cervix. And so that can cause a lot of problems for women. And that's probably something we'll talk about later in this chapter. But this is a good view of how all of those steps go through and happen. And this gives you an idea of the parts of when the baby's growing, how there's the blood exchange, the waste exchange, and all of those things happening with those maternal blood vessels through the umbilical arteries and vein and the umbilical cord, inside the umbilical cord, how the baby's protected through the amnion or amniotic sac and the amniotic cavity. The corpus luteum secretes this monthly to build up the lining of the uterus. Ooh, this is a tough one. Not sure if you were looking at that. You might want to go back and take a look one more time. What does the placenta secrete during pregnancy? Another good one. We kind of talked about that. This is a level of something that's measured, and it increases in those first few weeks of pregnancy. And it's what pregnancy tests check. Hopefully I gave you enough hints that you've got this one. So pregnancy. During pregnancy, progesterone maintains the placenta development. In fact, one of the ways that women can be helped through their pregnancy is to receive shots of progesterone to help maintain that placenta development. So if a woman has had several miscarriages, and the doctor may recommend that she get progesterone shots on a weekly basis to make sure that the placenta, or take progesterone tablets at the beginning to make sure that that stays well developed and to prevent miscarriage. It's not the only reason or influence on whether or not a woman miscarries, but it could be one. The uterus expands as the fetus grows. The uterus is a muscle, so it's going to increase, 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 and then it shrinks. Normal delivery, fetal position is cephalic presentation, which is head first. There are 3 phases of labor. There's dilation and thinning of the cervix, birth of the infant, and delivery of the placenta. And that's why I was talking about placenta previa before. If the placenta is attached to the uterus very close to the cervix, then when the cervix starts to thin and dilate, it pulls the placenta off, and that causes major problems for mom and baby. Not just bleeding, but lack of exchange of the oxygen and blood and nutrients and all of that to the baby. So that's why that is such a serious condition. And then you have the actual birth of the baby, and then the placenta has to be delivered. Long time ago, there were women who who died in childbirth 100 years ago, 150, 200, 300 years ago, that if for some reason they didn't deliver the placenta, it stayed in there, it caused a uterine infection. The mother became septic and died. And there were a lot of women who died after childbirth for a variety of reasons. Hand washing, lack of hand washing was a major one. And that's something you can research if this is of interest, but also failure to deliver the placenta. And that's not an issue anymore. That's taken care of, but back in the day, that was a concern. So what's a cephalic presentation? That's where the baby comes out head first. And usually the head is tilted downward. So the back of the head is what is seen first. But sometimes babies come face up. But head first is ideal. You can imagine if a baby is feet first, which is breech position, that can cause some issues. And then the other side of this, the right side of this slide, shows the delivery of the placenta. The placenta detaches after birth, and then it's removed. So let's talk about hormones. What does the pituitary do? It secretes that follicle-stimulating hormone, FSH, and the luteinizing hormone, LH. It stops producing those two hormones during pregnancy and with oral contraceptives, birth control pills. So the FSH and LH are the hormones that are used in a woman having a period, menstruating. And so that stops during pregnancy because the pituitary automatically knows, oh, hey, we're keeping this baby. We're not going to produce these hormones. And oral contraceptives say, we don't want a baby, so we're not going to produce those hormones. And that's why a lot of women who are on oral contraceptives oftentimes have very minimal periods, if any at all. What is menopause? Menopause is at the opposite end of the life spectrum, so to speak. It's the gradual ending of the menstrual cycle. It normally begins between ages of 45 and 55 with falling estrogen levels. There are women who do estrogen replacement therapy, but there are a lot of risks associated with estrogen replacement therapy, particularly breast cancer. So women who are going through menopause, estrogen helps with a lot of the symptoms that they experience from the stopping and the changes in all their hormones and whatnot, and those falling estrogen levels. But there is a definite known risk of breast cancer increasing with that. So just FYI. And women who, for whatever reason, maybe they have uterine cancer or endometriosis and end up having their uterus removed, they have to be very careful as well because of falling estrogen levels and whether or not they're going to do estrogen replacement therapy. So it's not just a natural menopause that is of concern. It's also when someone has menopause due to a surgical reason. So let's talk vocabulary. Adnexe uteri or uteri. Adnexe uteri. That's your fallopian tubes, ovaries, and supporting ligaments. And thankfully, that's a term that is very rarely, if ever, used. So hopefully you won't need to know that. And here are more. And it is possible to do vaginal ultrasound and be able to see a baby or I'm sorry, not see. It's possible to do vaginal ultrasound and hear the baby's heartbeat as early as week 5 in pregnancy. And more terms, definitions. And again, notice our good old Latin coming back at us, fimbriae and fimbria. So fimbria is singular, fimbriae is plural. If you've ever heard the term weeks of gestation, that there's 40 weeks of gestation. That's the period from fertilization of the egg to the time the baby is expected to be born. And some babies come early, like twins often come a few weeks early. It can also be late. There are some babies that like it so much they don't want to come till they're around 41 or 42 weeks along, but normally 40 weeks is the average normal expected time. And I'll pronounce this just so that you have it. Lactiferous ducts. Lactiferous ducts. And you notice a few slides back there was gynecology, and now you have neonatology. There's also obstetrics. That's probably on the next slide. Those are all different types of medicine. There are some pediatricians that neonatology is a field in and of itself, although those physicians can also treat children. Pediatrics, neonatology, obstetrics, those are three very different fields, and the doctors that train for them are focusing on very different things. So just as some of you have shown an interest in pediatrics, just be aware that neonatology is different than pediatrics. Not that a neonatologist can't treat a child, but they're really taught to focus on those babies right at birth in through the first couple of months. And pediatrics, although they can treat newborns, they're really more for once the baby's no longer in that neonatal time frame. And still more terms and meanings and definitions. So which term refers to the inner mucous membrane lining of the uterus? We talked about this. This should be fairly easy for you. We get to our combining forms. And again, our equation is a combining root plus a combining vowel equals combining form. And you use your combining form always with a suffix and sometimes with a prefix. Lots and lots of terms for this chapter. And combining forms. And we haven't even gotten to the prefixes and suffixes yet. We're still on combining forms. All right. Moving along here. I think we have over 100 slides on this one, so we'll keep moving. Which term means removal of the breast? Well, it's definitely ectomy for removal, but you need to look and see which root means breast. Okay, let's talk about pathology. What happens with the uterus? You can have cervical cancer, you can have cervicitis, which is inflammation, endometrial cancer, endometriosis. That's where endometrial tissue all of a sudden starts growing outside the uterus. It just shows up somewhere there in the pelvic cavity. It just starts growing all on its own. And it's a very unfortunate and painful condition. I have a friend who has that, and it's really tough. There's a lot of bad side effects to that one. Fibroids are benign tumors of the uterus. If you've heard of somebody who had they had a hysterectomy because of fibroids, that's an example of this. With your ovaries, you can have ovarian cancer, which is a very ugly type of cancer. They've been doing a lot of research and development of new treatments. It's no longer quite the death sentence that it was 20 or 30 years ago, but it's still a very serious cancer. Ovarian cysts. If you've ever heard of polycystic ovarian disease or syndrome, that's where ovarian cysts come in. Fallopian tubes, you can have pelvic inflammatory disease, and there's several types of that, how that plays itself out. And the leading causes of pelvic inflammatory disease are sexually transmitted infections. With the breast, you can have breast cancer or fibrocystic disease. If you've ever heard of someone who has fibrocystic breasts, that's just a type of breast disease. It's not cancerous, it's just something that they need to be aware of and have mammograms accordingly. So here's an example of a mammogram. It's that side view again, and it's showing us a carcinoma, a breast cancer. And on the right-hand side of the slide, it shows you what the cells actually look like. So you can see it on a mammogram versus on a slide of after being removed. So let's talk about pathology during pregnancy. You can have a premature separation of the placenta called an abruptio placentae. Choriocarcinoma, where the placenta begins to have a malignant tumor. You can have an ectopic pregnancy, which is misplaced implantation of egg. We talked a little bit about placenta previa before. Preeclampsia, that's very high blood pressure during pregnancy. And that can lead to all sorts of really bad things. Down syndrome affects the baby. Hemolytic disease. Now think about hemo and lytic. When we get to the blood system chapter, we might talk about this a little bit more, but it basically means that the blood cells are not doing what they're supposed to be doing. There's hyaline membrane disease, hydrocephalus. Some babies, especially those that are born after 40 weeks, are more at risk for meconium aspiration syndrome. That's where they've unfortunately had a bowel movement, and the bowel movement has gotten into the amniotic fluid, and the baby has breathed that in, and it's gotten into their lungs. They've aspirated it. Very serious condition. Pyloric stenosis. These are all things that can happen to the baby before they're born, or yes, before they're born. So when a baby's born, have you ever heard of APGARs? What was the baby's APGAR at 1 minute versus 5 minutes? Well, this is the APGAR scoring chart. They're looking at heart rate, respiratory effort, muscle tone, response to a catheter in the nostril after their oral pharynx is clear, and what is their color. And this gives you an idea. If the APGARs are 0 and even after a resuscitation there's 0, then unfortunately the baby is dead. They have to pronounce the baby dead. But there are babies who have very low APGAR scores and they are resuscitated and they do just fine 5 to 10 minutes after birth. So the APGAR scoring chart just really helps them know if you've got a child who scored 10, 9 or 10, you're doing great, they're perfectly healthy, it's a great day. Below that, it kind of gets pretty crazy there in the delivery room. So what are some clinical tests and procedures? There's a pap test, a pap smear test. That primarily looks for cancerous cells in the cervix. Pregnancy tests. There is a hysterosalpingography. Hysterosalpingography. There's mammography, of course, breast ultrasound, breast MRI. A lot of times if there's something unclear on a mammogram, they'll go ahead and ask the woman to stay for a breast ultrasound or even a breast MRI to get a much better view. And then, of course, there's pelvic ultrasonography. This is a conization. This is removing a cone-shaped section of the cervix, and this is a biopsy usually done for cervical cancer. This is a laparoscopic oophorectomy. This is a laparoscopic removal of an ovary. This is where they go in and they remove the ovary. The first picture is where the ovary is placed in a plastic bag, and then it's extracted through the laparoscope. It's amazing when you think about technology and how far it's come. What are some procedures that happen during pregnancy? One is amniocentesis, where they use ultrasound to guide the needle to place it in, and they remove some liquid from the they remove amniotic fluid, essentially, and they test it. And they can test it for a variety of reasons. It can be everything from making sure that the baby's lungs are sufficiently developed for birth, versus some have it done to see if there's something genetic or some kind of problem with the pregnancy where maybe the baby's not progressing the way that it needs to. So abbreviations, oh, lots and lots of abbreviations. And still more abbreviations. And still more. I didn't talk about para, and then it's followed by 4 numbers. Para has to do with a woman's reproductive history. The first number is how many full-term babies did she have. The next one is how many preterm babies, and how many abortions, and how many living children. And this is just to see, it's a way of keeping track and understanding what someone's history is that they've used. And you can look up the details behind it on the internet if you're interested. But you may see that in a lot of OB charts, is the para and then the numbers. A primipara is someone who is having their first baby. Just in case you were wondering. Primi means first. And now we get to our combining forms. And remember, our combining forms are made up of a combining root plus a combining vowel. Most of these you saw earlier in the slides, but some of them are additional since then. So it's all good review. Did you notice that about egg? OV is egg, OVUL is egg, and if I go back here, O is egg. So you have three potential combining forms for that all mean egg. It can be O, it can be OV, or it can be OVUL. And the same for ovary. You've got oofer and ovary. Who knows why, but just make sure that you make a note of that as you're studying, maybe with your flashcards. And still we have more. Again, some of these you've had before, but still good review. And just a few more. And that is it. Hey, we did it in 32 minutes. We're doing well. Lots of information in this chapter, I know. I'm going to come back after this and we'll talk about the male reproductive system. Have a good rest of your day.